All India Radio presents Morning News. Good morning. I'm Sunil Verma and with me is VC Pramod. The headlines. Prime Minister Narendra Modi chairs a high-level meeting to review the availability and supply of oxygen and medicines. PM CARES Fund accords sanction for procurement of 150,000 units of Oxycare system developed by DRDO. Union Cabinet approves production-linked incentive scheme for advanced chemistry cell battery storage. India administers more than 17 crore 70 lakh doses of COVID-19 vaccine in the country so far. Himachal Pradesh government decides to provide free COVID treatment to the beneficiaries of HimCare and Ayushman Bharat scheme in registered private hospitals of the state. Indian Navy Chief Admiral Karambir Singh says Navy has been supporting civilian authorities in several states to deal with the pandemic. Ministry of Steel says a total of 4,686 tons of life-saving liquid medical oxygen supplied by steel plants so far. Central government, in consultation with Reserve Bank of India, decides to issue sovereign gold bonds. In Bihar, 15 people killed and 9 injured due to lightning and rain-related incidents. US President Joe Biden speaks to Prime Minister of Israel, Benjamin Netanyahu, on Israel-Palestine conflict. As the number of COVID cases is on the rise, we appeal to our listeners to take all precautions and all those above 18 years of age to get vaccinated without any hesitation. The vaccination for persons of age between 18 and 44 has begun at designated facilities. Stay safe and protected by following these 3 simple steps. Wear a face mask. Maintain 2 gaz ki duri for social distancing. Focus on hand and face hygiene. And now the news. Prime Minister Narendra Modi chaired a high-level meeting to review the availability and supply of oxygen and medicines yesterday. He was informed that the government is actively monitoring the supply of drugs being used in the management of COVID as well as mucormycosis. Various union ministers also informed the Prime Minister that they are in regular touch with the manufacturers to enhance production and extend all help needed. Mr. Modi was also informed about the current production and stock of active pharmaceutical ingredients for each such drug. The Prime Minister was also apprised that the production of all drugs, including remdesivir, have been ramped up significantly in the last few weeks. Mr. Modi said that India has a very vibrant pharma sector and that the government's continued coordination with them will ensure proper availability of all medicines. The Prime Minister also took stock of the oxygen availability and supply in the country. It was noted that the supply of oxygen is now more than 3 times the supply during the peak of the first wave. He was briefed about the operations of oxygen rail and sorties by Indian Air Force planes. The PM CARES Fund has accorded sanction for procurement of 150,000 units of Oxycare system developed by Defence Research and Development Organisation DRDO at a cost of over 322 crore rupees. Oxycare is an SpO2-based oxygen supply system which regulates the oxygen being administered to patients based on the sensed SpO2 levels. Under this sanction, 1 lakh manual and 50,000 automatic Oxycare systems along with non-rebreather masks are being procured. The automatic system also provides suitable audio warnings for various failure scenarios, including low SpO2 values and probe disconnections. The non-rebreather masks are integrated with the Oxycare systems for efficient use of oxygen, which results in saving of oxygen by 30 to 40%. The non-rebreather masks need to be changed for every patient. These Oxycare systems can be used at homes, quarantine centers, COVID care centers and hospitals. The DRDO has transferred the technology to multiple industries in India, which will be producing the Oxycare systems.
Indian Navy Chief Admiral Karambir Singh has said that the Navy has been supporting civilian authorities in several states to deal with the coronavirus cases. He said all the Navy teams are putting their shoulder to the wheel to support the national effort. In his message to Indian Navy personnel, communities and ex-servicemen, he said this is the biggest humanitarian challenge to the country since independence. Admiral Singh said COVID-19 is also spreading in rural areas and the naval units should adopt villages and render assistance. He said Navy has marked 111 ICU beds for civil use and 450 bedded additional capacities have been created. He said over 200 personnel are deployed in COVID hospitals. The Navy chief said the country has tremendous faith in its armed forces and it is our duty to live up to the expectations of the citizens. He said the Navy has already launched a mega operation to bring liquid medical oxygen from several countries.
Second wave में Operation Samudra Setu के तहत we have brought nearly 21 containers, each of 20 metric ton capacity, out of which 13 जो है liquid medical oxygen से filled है. तो हमारा commitment है कि 3,000 metric ton हम लेके आए. As part of medical support to civilian agencies, naval hospitals में 111 ICU beds civil use के लिए किए गए. हमने करीब 450 बेड्स की एडिशनल कैपेसिटी क्रिएट कर ली है. जो पैंडेमिक है अभी वो रूरल एरियाज में स्प्रेड हो रहा है तो उनको हमारा हेल्प चाहिए. मेरा रिकमेंडेशन है कि जो आउटलाइन यूनिट्स हमारे नेवल यूनिट्स हैं दे शुड अडॉप्ट विलेज और उनको असिस्टेंस रेंडर करना चाहिए.
The Ministry of Steel has said that a total of 4,686 tons of life-saving liquid medical oxygen LMO have been supplied by the steel plant so far. The ministry said the steel fraternity stands united in the service of the nation in this time of crisis. The total production of liquid medical oxygen in the country has risen to almost 9,500 tons per day, showing the capacity utilization of about 130% of the installed capacity. He said steel plants are contributing nearly half of the national production of LMO. Steel plants are able to enhance the supply of LMO by reducing the production of nitrogen and argon and producing only LMO in most plants.
The Union Health Ministry has said that swift clearance and apportioning of global aid by the centre has strengthened tertiary medical care across states and union territories for COVID management. The ministry in a statement said that various ministries are collaborating through a streamlined and systematic mechanism under the whole of government approach for expeditiously delivering the incoming global aid from different countries. So far, 9,284 oxygen concentrators, 7,033 oxygen cylinders, 19 oxygen generation plants, 5,933 ventilators, and bi-level positive airway pressure BiPAP machines, and 3,44,000 remdesivir vials have been delivered. India has administered more than 17 crore 70 lakh doses of COVID-19 vaccine in the country so far. These include over 95 lakh 98,000 healthcare workers who've taken the first dose and more than 65 lakh healthcare workers who've taken the second dose. Over 1 crore 42 lakh frontline workers have taken the first dose and more than 80 lakh frontline workers have taken the second dose. The Union Health Ministry said that more than 17 lakh 72,000 beneficiaries were inoculated with COVID-19 vaccine doses till 8 p.m. yesterday.
Union Health Minister Dr. Harshvardhan yesterday held a meeting with health ministers of 7 states and 1 union territory and reviewed the progress of the COVID-19 vaccination drive. These states included Uttarakhand, Haryana, Punjab, Bihar, Jharkhand, Odisha and Telangana, along with the Union Territory of Jammu and Kashmir. During the meeting, he discussed the steps to accelerate the vaccination drive. Speaking on the occasion, Dr. Harshvardhan said,
कोविड के खिलाफ जंग को तेज करने का प्रयास किया है. हम सब जानते हैं कि पिछले 24 घंटे में देश में लगभग 3,48,421 कोविड के केसेस रिपोर्ट हुए हैं. लेकिन इसी के साथ साथ हम सबके लिए ये भी संतोष की बात है कि 3,55,338 केसेस जो कि होने वाले केसेस से संख्या ज्यादा है, इतने रिकवर होकर सकुशल घर भी लौटे हैं. इस पेस को बराबर हमें मेंटेन करना है ताकि धीरे धीरे हमारे जो एक्टिव केसेस की संख्या वो हर रोज पिछले दिन से कम होती जाए.
Amid the COVID-19 pandemic, the government is continuously engaged in supply of oxygen, medical equipments and medicines in the country. In an exclusive interview with AIR News, convener of Empowered Group 2 of Secretaries Giridhar Aramane said,
All the hospitals have to be made self-sufficient, especially the large ones in the metropolitan cities and Tier 1, Tier 2 cities. So, Honorable Prime Minister was kind enough to sanction 1,051 PSA plants out of the PM CARES Fund. So, to ensure that we got enough wherewithal within the country to manufacture these machines, these plants, the country and supply to the hospitals, we started exploring the manufacturers in our country.
Bihar Chief Minister Nitish Kumar has called upon the people of the state to fight against the COVID-19 pandemic with strong willpower and positive thoughts. Mr. Kumar said in the wake of a sudden rise in COVID cases, the state government enforced lockdown from May 5th to May 15th. As a result of the rate of infection is decreasing, he urged the people to cooperate for the success of the lockdown.
बढ़ते कोरोना संक्रमण को देखते हुए 5 मई से 15 मई 2021 तक बिहार में लॉकडाउन लगाया गया है। लॉकडाउन की सफलता के लिए सभी बिहारवासियों के सहयोग की आवश्यकता है। लॉकडाउन शुरू करने से कोरोना मरीज की संख्या में कमी आना शुरू हो गया है। मेरी आप सबसे अपील है कि मास्क लगाएं, 2 गज की दूरी बनाए रखें, हाथ साफ रखें और समय आने पर टीका अवश्य लगवाएं। मुझे पूरा भरोसा है कि हम सब मिलकर इस बीमारी पर अवश्य विजय प्राप्त करेंगे।
The Uttar Pradesh government has said that any proof of residence in the state will be sufficient for any person aged between 18 and 45 years to get vaccinated. The government, in its latest order, made Aadhaar card and permanent residency certificate not mandatory for getting the COVID-19 vaccine for the age group between 18 and 44 years. Uttar Pradesh Chief Minister Yogi Adityanath will visit Aligarh Muslim University today. COVID infection is on the rise in the campus and many faculty members and employees have lost their lives recently. The Chief Minister spoke with the Vice Chancellor of the university 2 days ago regarding the spread of corona infection in the campus and adjoining areas. He assured support to the AMU administration in the vaccination drive. 18 serving faculty members of the university have succumbed to the disease.
In Chhattisgarh, efforts are being made to increase test facilities for identification of COVID patients. The rapid antigen test facility is being made available in all 14 municipal areas of the state from today.
In Chhattisgarh, 49 test centers have been set up in 14 municipal areas to conduct a rapid antigen test. In these centers, tests will be done round the clock and 7 days a week. Meanwhile, a virology lab for RT-PCR test has set up in Baikuntpur in Korea district of the state. With this, the facility of RT-PCR testing has been made available in 10 government laboratories in Chhattisgarh. This will make it easier to identify corona-infected patients and provide timely treatment to them. On an average, more than 60,000 samples are being tested daily to identify corona-infected patients in the state. Vikalp Shukla, AIR News, Raipur.
In Jharkhand, the state government has extended the restrictions followed under the Health Safety Week further for a period of 2 weeks from 6 a.m. this morning till the morning of May 27th. The decision was taken during a meeting of the State Disaster Management Department chaired by Chief Minister Hemant Soren. More details from our correspondent.
The Health Safety Week protocols followed in Jharkhand from last 3 weeks continuously have resulted in breaking the chain of COVID-19 infection and reducing the infection rate by almost 50% in last 10 days. Recovery rate has improved to 81.85%. The state government, following its effective results, has further increased the existing Health Safety Week for a period of 2 weeks till May 27, beginning today. In addition to the existing guidelines, interstate and intrastate buses have been stopped and mandatory home quarantine of 7 days for people coming from outside the state has been added during the 2 weeks period of Health Safety Week. Only 11 people have been allowed for marriages to be held either in court or home during this period. Shilpi, AIR News, Ranchi.
In Gujarat, more than 578,000 patients have recovered from COVID-19 till now. According to the State Health Department, 15,264 patients have recovered during the last 24 hours. The recovery rate has improved and reached up to 80.94%. More from our Ahmedabad correspondent.
Gujarat has recorded 11,017 new cases of COVID-19 yesterday. Maximum 2,795 new cases reported from Ahmedabad, while Surat reported 781 new cases. 102 patients lost their lives yesterday. With this, the death toll due to COVID-19 in the state has reached up to 8,731. Gujarat has now 1,27,483 active cases at present, out of which 804 patients are on ventilator. Meanwhile, 1,87,724 persons have been vaccinated in the state yesterday. Out of these, more than 90,000 persons have been given the second dose of vaccine. Yogesh Pandya, AIR News, Ahmedabad.
In Andhra Pradesh, 21,452 more COVID-19 positive cases have been recorded during the last 24 hours, while 19,095 persons have been discharged from various COVID hospitals in the state. In Madhya Pradesh, black fungal infection treatment units with operation theatres OTs will be opened in Bhopal and Jabalpur. Chief Minister Shivraj Singh Chauhan informed that so far 50 black fungal infection cases have come to notice in the state. More from our Bhopal correspondent.
In the medical colleges of Bhopal and Jabalpur, there will be 10 beds in each unit to treat this disease. A team of doctors from 4 departments, ENT, ophthalmology, medicine and neurology will be working at these units. Chief Minister at a review meeting said that there is no need to panic regarding black fungal infection. Treatment is easy in the early stages and the government will cooperate with poor patients in their treatment. Medical Education Minister Vishwas Sarang informed that US doctors are also being consulted to tackle black fungal infection. Meanwhile, state government is also devising preventive strategy which includes measures such as rational use of steroids in COVID patients and educating patients to identify the primary signs of disease. Pooja P. Vardhan, AIR News, Bhopal.
You are listening to the morning news on All India Radio. A reminder of the headlines before we move on. Prime Minister Narendra Modi chairs a high-level meeting to review the availability and supply of oxygen and medicines. PM CARES Fund accords sanction for procurement of 150,000 units of OxyCare system developed by DRDO. Union Cabinet approves production-linked incentive scheme for advanced chemistry cell battery storage. India administers more than 17 crore 70 lakh doses of COVID-19 vaccine in the country so far. Himachal Pradesh government decides to provide free COVID treatment to the beneficiaries of HimCare and Ayushman Bharat scheme in registered private hospitals of the state. Indian Navy Chief Admiral Karambir Singh says Navy has been supporting civilian authorities in several states to deal with the pandemic. Ministry of Steel says a total of 4,686 tons of life-saving liquid medical oxygen supplied by steel plants so far. Central government, in consultation with Reserve Bank of India, decides to issue sovereign gold bonds. In Bihar, 15 people killed and 9 injured due to lightning and rain-related incidents. US President Joe Biden speaks to Prime Minister of Israel, Benjamin Netanyahu, on Israel-Palestine conflict. For quick news updates round the clock, follow us on Twitter at AIR News Alerts.
The Himachal Pradesh government has decided to provide free COVID treatment to the beneficiaries of HimCare and Ayushman Bharat scheme in registered private hospitals of the state. More from our correspondent.
By this decision, around 9,29,000 beneficiaries covered under HimCare and Ayushman Bharat Health Scheme would now get free treatment of COVID-19 in private hospitals, which are registered as a dedicated COVID hospitals by the state government. The state government has also decided to prioritize certain section of society for vaccination, keeping in view the nature of their work. It includes drivers and conductors of private and HRTC buses, fuel pump operators, PDS depot holders, teachers on COVID duty, bank and finance service staff, food and civil supply staff, chemists and Lok Mitra Kendras. Meanwhile, the process of vaccination for the age group of 18 to 44 will start in the state from 17th of this month. Sanjeev Sundariyal, AIR News, Shimla.
The national capital yesterday reported 13,287 new COVID-19 cases, while 300 people succumbed to the virus in the last 24 hours. Delhi had reported 12,481 cases on Tuesday, while on Monday it reported 12,651 cases. The daily positivity rate in the national capital remained below 18% for the second consecutive day at 17.03%.
The Union Cabinet has approved production-linked incentive scheme for the Advanced Chemistry Cell ACC battery storage with an outlay of 18,100 crore rupees. Briefing media in New Delhi after the cabinet meeting, Information and Broadcasting Minister Prakash Zavadekar said the move aims to achieve manufacturing capacity of 50 gigawatt-hour of ACC and 5 gigawatt-hour of niche ACC with an outlay of 18,100 crore rupees.
ये बैटरी स्टोरेज के लिए प्रोडक्शन लिंक्ड इंसेंटिव उत्पादन को प्रोत्साहन देने वाला ऐसा एक 18,100 करोड़ रुपीस इंसेंटिव की योजना मंजूरी दी है। इससे 50,000 मेगावाट का टारगेट है कि वहां तक उत्पादन भारत में बढ़ेगा आने वाले चंद सालों में और आगे ये उत्पादन बढ़ता जाएगा जरूरत के अनुसार। इसमें 45,000 करोड़ रुपीस इन्वेस्टमेंट फॉरेन एज वेल एज इंडियन होगी।
Mr. Zavadekar said it will also give a big push to electric mobility, benefiting three-wheelers, four-wheelers and heavy vehicles. He said India is currently importing battery storage equipment worth 20,000 crore rupees and the scheme will be helpful in making the country self-reliant, Atmanirbhar. In Bihar, 15 people were killed and 9 injured due to lightning and rain-related incidents in 8 districts of the state. The Met Department has predicted heavy rains and lightning in different parts of the state in the next 24 hours. People have been advised to remain indoors during the natural calamity. Chief Minister Nitish Kumar has expressed grief over incidents and announced ex gratia payment of 4 lakh rupees to the next of the kin of the deceased. Mr. Kumar has ordered free treatment to the injured persons.
The central government, in consultation with the Reserve Bank of India, has decided to issue sovereign gold bonds. The sovereign gold bonds will be issued in 6 tranches from this month to September 2021. The Ministry of Finance in a statement said that the date of subscription of the tranche 2021-22 Series 1 will be from 17th to 21st of May and date of issuance will be 25th of May. Similarly, the date of subscription for Series 6 will be from 30th of August to 3rd of September and will be issued on the 7th of September. The ministry said the sovereign gold bonds will be sold through scheduled commercial banks, stockholding corporations of India Limited, designated post offices and recognized stock exchanges. The minimum permissible investment will be 1 gram of gold. The ministry said investors will be compensated at a fixed rate of 2.5% per annum, payable semi-annually on the nominal value.
U.S. President Joe Biden spoke to the Prime Minister of Israel, Benjamin Netanyahu, on the Israel-Palestine conflict. President Biden said he hopes that the hostilities will come to a conclusion. Speaking to the media at the White House, President Biden said he had a conversation with the Prime Minister of Israel and he feels that this will come to a conclusion sooner than later. He added that Israel has a right to defend itself when thousands of rockets are flying into their territory. The U.S. President spoke on the issue for the first time since the violence erupted this week. According to White House, in a telephonic conversation with Netanyahu, Mr. Biden condemned the rocket attacks by Hamas and other terrorist groups. President Biden conveyed his unwavering support for Israel's security and for Israel's legitimate right to defend itself and its people while protecting the civilians. According to the Health Ministry of Gaza, death toll rose to 65 Palestinians. According to the Times of Israel, the death toll has reached 7 in Israel. In eastern Ladakh, 80 kilometers away from Leh, Kungyam is a small village surrounded by the mountains. The villagers depend on the radio to gain knowledge. Our Leh correspondent has sent us this report on the occasion of 50 years of AIR Leh services.
This is the first revenue village in vastly spread Changtang region in pre-independence regime. However, as the first revenue village, the awareness on power of knowledge has made the villagers avid radio listeners. Mainstay of villagers is farming and animal rearing. However, villagers are keen in gaining knowledge through listening to radio. Villagers keep radio as company to listen to news or their favorite Ladakhi program on All India Radio. Villager Tashi Paldan says,
खबर भी सुनता हूँ, सारा प्रोग्राम मतलब वीडियो में जो भी हम खोल के दुनिया का तो सारा मिल जाए। फिर भी लद्दाख की प्रोग्राम मिलना बहुत जरूरत है, क्योंकि इसमें बूढ़ा बूढ़ी बहुत व्यापारी पढ़ा लिखा वाला काम है, तो ज्यादातर जो है लद्दाख की न्यूज सुनना, लद्दाख की जितना भी लद्दाख की प्रोग्राम है वो सुनता है, बहुत जरूरी है यहाँ।
Considering the mountainous topography of the region, villagers' appeal for better reception of radio signal would further help interior villages like theirs in gaining more information on government schemes and programs from time to time. With District Dolma in Kungyam, Ramesh Chandra from Leh for All India Radio News.
The Indian Met Department has said that a cyclonic storm is expected in the Arabian Sea on the 16th of May. In a tweet, IMD Mumbai has said that a low-pressure area is very likely to form over the southeast Arabian Sea around the 14th of May.
A thunderstorm and light rain lashed various parts of the national capital region in early hours today. The rain also brought down the temperature below normal and provided much-needed respite from the hot weather to the residents. According to the India Meteorological Department, Delhi is likely to receive rain for the next 2 days. The weatherman has predicted partly cloudy sky, and the maximum temperature is likely to hover around 36 degrees Celsius. And now let us take a look at the weather forecast for today. The national capital, Delhi, will have thunderstorm with rain. The temperature will hover between 24 and 36 degrees Celsius. Mumbai will have a partly cloudy sky. The minimum temperature was 27 degrees, while the maximum is expected to be around 34 degrees Celsius. Chennai will have a partly cloudy sky. The temperature will hover between 28 and 37 degrees Celsius. Kolkata will have rain or thunder showers with strong gusty winds. The minimum temperature was 23 degrees Celsius and the maximum will be 34 degrees. Jammu will have a generally cloudy sky. The minimum temperature was 22 degrees Celsius, while the maximum will be around 34 degrees. Srinagar will have thunderstorm with rain. Temperature will hover between 12 and 20 degrees Celsius. Leh is expected to have generally cloudy sky with 1 or 2 spells of rain or thunder showers. The temperature will hover between 5 and 17 degrees Celsius. Gilgit will have a partly cloudy sky with 1 or 2 spells of rain or thunder showers. The temperature will hover between 13 and 28 degrees Celsius. Muzaffarabad will have thunderstorm with rain. The minimum temperature was 18 degrees Celsius and the maximum will be around 28 degrees. Dehradun will see thunderstorm with rain. The minimum temperature was 20 degrees Celsius while the maximum will be around 31 degrees. Chandigarh will have a generally cloudy sky with 1 or 2 spells of rain or thunder showers, with the temperature likely to hover between 23 and 31 degrees Celsius. In Hyderabad, rain or thunder showers would occur towards evening or night. The minimum temperature was 27 degrees Celsius, while the maximum will be around 38 degrees.
And now an overview of today's newspapers. PM Modi reviews oxygen, medicine availability, writes Financial Express. Covaxin gets nod to begin trials for ages as young as 2, reports Hindustan Times. Opposition urges PM to start free universal vaccination, writes The Hindu. The Tribune writes government approves 322 crore rupees from PM Cares for DRDO's Oxycare. And finally, in some heartening news, 103-year-old Gandhian and freedom fighter H.S. Duraiswamy beat COVID and is now back home, reports The Statesman.
And now, before we end the bulletin, the headlines once again. Prime Minister Narendra Modi chairs a high-level meeting to review the availability and supply of oxygen and medicines. PM Cares Fund accords sanction for procurement of 150,000 units of Oxycare system developed by DRDO. Union Cabinet approves production-linked incentive scheme for advanced chemistry cell battery storage. India administers more than 17 crore 70 lakh doses of COVID-19 vaccine in the country so far. Himachal Pradesh government decides to provide free COVID treatment to the beneficiaries of HimCare and Ayushman Bharat scheme in registered private hospitals of the state. Indian Navy Chief Admiral Karambir Singh says Navy has been supporting civilian authorities in several states to deal with the pandemic. Ministry of Steel says a total of 4,686 tons of life-saving liquid medical oxygen supplied by steel plants so far. Central government, in consultation with Reserve Bank of India, decides to issue sovereign gold bonds. In Bihar, 15 people killed and 9 injured due to lightning and rain-related incidents. US President Joe Biden speaks to Prime Minister of Israel Benjamin Netanyahu on Israel-Palestine conflict. And with that, we end the morning news. Have a nice day.